Stephen, we want to sort of look into um, research in health and social care, and then focusing on knowing how to identify and justify a topic for research within services for health and social care. Knowing how to identify and justify a topic for research within services for health and social care. Okay. Now, we've had extensive discussions on the importance of research in health and social care. We did mention that the purposes of research is to give a diagnostic diseases and also to find out various problems within a certain locality or nation, country, so to speak, bring out the solutions to solving those problems. Okay. Those were the key fundamental things that we ought to know about research. Okay. All right. Now, if you look at the research proposal template, you can find quite a number of informations in here. And this video I'm going to share as well, so you can watch a later part of today. Okay. Let me share this video on the group. Then you can have this in there as well. That's it. I've shared the video so you can watch later on. Okay?
All right.
All right. So let's proceed.
Okay.
Victor, you should have been part of my previous lectures, isn't it? We've had, yes, you have, John. Stephen has not been. I've not seen Stephen before.
No, I was. I told you.
Stephen, you were?
No, I'm not. This is my first time.
Yes. Stephen, that's your first time. But Victor, you have been part of my previous lectures. You have
Yes,
been
yeah,
part of-
lectures, yes.
Okay,
More
that's
than
fine.
one or two of them.
That's true. Okay. And so I did mention that the reason for research is that you do research based on what you want to solve or come up with ideas
Yes.
to solve a particular issue that you have identified within the healthcare sector
Yes.
and all that. And I gave an example that if you live in a family and if you live in a family, if you live in a family and nobody has attained the position of a degree or a master's before, or no one has lifted up his level of education, you then want to sit down and check what may be the cumulative effects why nobody has been able to achieve a degree or a master's before. Okay, and so that's what research does. Okay, that's what research does. Okay, so we have what we call the evidence-based practice, the EPB, which is a process used to review, analyze, and translate the latest scientific evidence. I spoke about this and I gave you guys an example. The example was, I say, if you go to the hospital, you have what we call the early warning score, the early warning scores. The early warning scores, what it does is there's a machine that they normally put it around your hand in the UK. And those machines is able to detect your temperature. How many of you are used to have seen that machine before?
I've done it a lot. I've done it a lot. That's
Stephen, are you with me? Stephen?
Yes. Yeah. That's called ops machine.
That's the ops machine. Amazing. That's the ops machine. Stephen, are you used to that?
Yeah.
Yeah, so that ops machine can tell your pulse rate and can tell your temperature and can tell your pulse rate. It can tell many things about you.
Your
This
oxygen.
informs the
It
nurses.
has
Yes.
different
Yes. This informs the nurses how to know your condition, isn't it?
Yes.
Whether or not you
Your heart
have
rate,
high
your everything.
blood pressure or high, they can tell. And that
Yeah.
would see whether they have to give you certain medications or they have to admit you in the hospital or they have to refer to a doctor and all that. And that is there.
Yes.
And all these things are research based.
Mm.
It is somebody who have done the research and seen that, oh, if we have this machine available, isn't it? It will
Yes.
help to build. Exactly. We call it the early morning score.
Yes.
EWS. Are we together?
Yes.
Yes. Yes.
Good. And so the same way, the nurse is able to do this. So then the nurse can, or the support worker can do this so that they can report and say, okay, per the calculation of your observation, we realize that you are scoring 8, scoring 7, scoring 6, which is very high, isn't it?
Yes.
Yes.
That news.
That's news. Thank you. And per that news, it will show what you need to be done again, whether they need to say a doctor immediately, because
Oh, yeah.
first call demands immediate attention, isn't it?
Yes.
Exactly. And so when we say EPB, it is what? A process to review, analyze, and translate latest scientific evidence. The goal is to quickly incorporate the best available research along with clinical experience
Yes.
and patient preferences into clinical practice. Okay,
Yes.
good. Then so what do we do in EPB? You do an inquiry, try to find out spread to the patient, do a practice and learning, and then you also do a reflection, an inquiry, practice, learning, and then you also do a
Yes.
reflection. Okay.
Yes.
Now, why is it important to consider ethical? Why is ethical consideration very important? Why ethical consideration is very, very important? Why ethical consideration is very, very important?
Can you
Why
ask the
in
question?
research work? Why ethically? Why do we have to? Now, it is very important we consider the ethical part of because in research, you are going to get people to participate or you are going to question people, what we call questionnaire. And
Yes.
so whatever information you want to gather from them should not go to affect them their future, isn't it?
Yes.
So people are going to give you information based on what you question them or your questionnaire. And the answers they give you should not be something that should be used against them. And so it
Yes.
should be very
It's
ethical.
anonymous.
You have to seek consent from them, isn't it?
Yes.
Those are all ethical considerations. Sometimes it may not be the questionnaire, maybe participants. Maybe you're organizing a survey, and in your survey, there are participants part of the survey. You need to let them know why you're collecting this survey and what you're going to intend to use them. So you have to be very ethical. Okay?
Yes.
Good. A timeline is essential tool that illustrates the chronology of events or activities. We use timelines for research, studies, and event planning. Timelines make it easier for students to understand the historical events related to any subject in an orderly manner. In a timeline, you should include the starting and ending date of your project and important milestones. You should also make sure that there is a reference to the events that you include in your timeline in your project description. Okay? Okay, so timeline is just you have to make sure your project follows a chronology of it. You don't just jump to methodology when you don't have literature review. You understand? You
Yes.
don't jump to literature review when you don't have objectives. Every project should have objectives. Okay, the project
Yes.
name, you have the objectives, the aims, and objects. So you
Yeah.
cannot jump to literature review or methodology when you've not stated your objectives and your aims. You understand?
Yes.
Exactly. Okay, and then the timelines should clearly show the date you are starting, the date you are ending, and then the tasks involved within that period of the start time and the start and the end time. All right.
Yes.
Do you have any questions at all? So if you work in a site, the site managers, When they give them a task
Are
to
you
build
okay?
houses, they have a start date, don't they?
Yes.
And then they have expected time to date to finish, isn't it?
Yes.
So we may have expected time of arrival and expected time of departure. If you are joining the plane, if you have a flight, they always give us an expected time the flight
Yeah.
starts, isn't it?
Yes.
They even give out check-in point, isn't it?
Yes.
So you have a check-in time. That check-in time, it has duration, isn't it?
Yes.
If you miss the duration, you're going to miss your flight. Am I
Yes.
right?
Yes.
And the flight also, they also tell us expected time the flight may take off, isn't it? So these are all what we call deliverables. Okay, these are all things that we need to consider in our what do you call in our project work. You know, your timelines are very important. What time your supervisor gives you when you are going to start your project work, and what time they expect, what date they expect that you hand over your project work. Those are very important things that we need to take notice of. Okay. And so what do we do in projects where we assess? There's so much noise at the background. We have to assess the topic that we are choosing. We ought to then evaluate. Then we ask questions how from supervisors or from your participants that you try to include them in your project work. And then you apply them. How do you apply them? You apply them through literature review, through methodology, through data submission, through data present interpretations, through histograms, through pie chart. We put them, okay, we show them percentage of people that you interviewed, those who said you, those who said no, those who were neutral, and then you acquire knowledge in that regard as well. And then what do you do finally? You do what we call appraisal. You review. Appraisal is reviewing. Okay.
Yes.
You appraisal, you review. Okay. So what is research aim? I've explained that already. Research aim is to what? To describe the purpose of a main goal of a project. It helps you it helps your reader to understand the focus of your research and gives them an idea of what you are trying to accomplish. Research aims are found in their own subsection under the introduction section of all research documents, regardless of whether they are dissertations or research papers. Okay. Very, very, very important. In most situations, a research aim is expressed as a broad statement of the main goal of this study and does not need to be more than one sentence. The exact format of the outline will vary depending on your preferences, but it should also explain the purpose, your objective, and how you can plan to accomplish it, and of your objectives. Okay. So the research aim is why are you doing the research, or why is the research necessary? You might have identified a problem. What is the purpose of your study, and how will you accomplish it? You understand? Victor or Stephen, somebody's talking at the background. Why is the research necessary? Because you've identified a problem. What
Yes.
is the purpose of the study?
Medication.
And how would you accomplish it? Stephen, are you together? Okay. So, and what is research objectives? Research aim defines what your study is going to answer. About research objectives outline how it's going to answer it. Those objectives break down each component of your research project into smaller portions, each representing a key section of it. That's almost all dissertations and theses are organized into a normal list, with each them getting its own chapter. Okay. Those objectives break down each component of your research project into smaller portions, each representing a key section of it. Thus, almost all dissertations and theses are organized into numbered lists, with each item getting into its own chapter. Okay, and that's one of the research aims. Each of the research objects should have the following: a specific. When we say specific, what area of the healthcare are you trying to digress your project work or your research work? Okay. It is the action you intend to take unclear or is focused and well defined. Okay. Accessible. What method will you use to measure your progress and determine when you have accomplished your goal? Obtainable. Okay. Do you have the necessary support? This is what we call the SMART analysis. How many of you know that? the SMART analysis, SMART, specific, accessible, obtainable, relevant, and time-bound. Are we together? This is what we call the SMART analysis. So what there is the difference between your research objects and aim? The aim focuses on what project proposes to achieve. The object focuses on the short-term, immediate.
Ambulance is coming by 4.
So your research objectives are more
Ambulance is coming very
specific than
soon.
the research aims. Okay, the objects are more
Not
specific.
The ambulance is coming
The aims
up.
are more long-term. Okay, your objects are very specific. How do you hope to achieve that specifically? I hope to do this. I hope to do that. The aim are more long-term.
Yeah.
It will be best to write an objective as a numbered list. Research aim can be written in one sentence or short paragraph. Okay. Are we together? Are we together?
Yes.
All right. Any questions at all? Aims and objects. Any questions at all?
No, sir. Would like a cup of coffee?
Okay. I've mentioned that the ethical considerations that apply to an area of research, I've mentioned that ethical considerations are important. One, so that you don't betray whoever you're passing. Confidentiality should be upheld. Okay. Privacy should be upheld. The person's information should be upheld. If you are trying to, if you've gone undercover, you're trying to interview some prostitutes, and some of them open up and tell you certain information why they are undertaking prostitution, you need to make sure you upheld their privacy. Okay. Okay. You need to make sure you upheld their privacy. Very, very important. You need to make sure you upheld their privacy. All right. Ethical issues of informed consent, risks of harm, confidentiality, and anonymity and conflict of interest must be considered and presented with a plan on how these ethical issues will be managed. Okay. So ethical is very important because the very people that you're trying to gather information or the things that you seek to do, it should be very ethical and very sound. You don't betray them. You don't say things. You don't give out information that will not help. It may not be ethical because they've given you their consent. You have to seek consent from them to be able to gather those informations and then put it into a data or something. So you have to make sure your information that you are gathered, they are very ethical and very sound. Okay. And how many of you know what we call a SWOT analysis? SWOT analysis talks about strengths, weaknesses, opportunities, and threats. So you analyze your own current skills and knowledge in being able to conduct a literature review in health and social care towards evidence-based practice. And so SWOT analysis, you can then assess your current skills, okay? How strong are you in those skills? If it's IT skills, how good are you in PowerPoint? How good are you in Excel? And then if there's any weakness, probably you struggle in presentation, PowerPoint, and all that. Are there opportunities that you have to look into in exploring more in those opportunities? Are there any threats? Are there any shortcomings that you encounter when you are engaging in your research work? And if you look at those that you are struggle, maybe how to diagrams in methodology and all that, then you can learn and build upon. Okay. And these are the references for today. Okay. We'll bring today's lecture to an end. I think there's a lot of distractions from Victor as well. Stephen,
Not
do you
me.
have any
No,
question?
not me.
Oh, okay, there is Stephen rather.
But
Okay.
maybe because it's like that guy. It's like person is at work because the noise is
Okay.
coming from. Give me this. Give me
Okay.
that. Not
Do we
me.
have any questions at all, Victor?
No, don't have.
Stephen, any questions at all? Hmm? Are we together? Are we together? Are we together? Okay. Since there's no questions, I'll bring today's meeting to an end, okay? So let's catch up another time, okay?
Okay.
All right, see you guys. Bye.
Bye.